Hi, I'm Allison Santoro with CNY Fertility's Donor Egg Program, here with you today to talk about our Donor Egg Program. I'm going to start by talking about our various packages that we offer. Our first package option available is for 6 fresh eggs, which includes a fresh embryo transfer. This package option will offer you your best success at 55%. Our second package option is for 6 fresh eggs to create and freeze embryos. With this package option, your success is 50%. We do require that you have your partner's frozen sperm on hand for when the donor is ready for egg retrieval. If you're using donor sperm, we would like the donor sperm here and in our office in storage. Our third package option is for 6 frozen eggs or banked eggs, and this package option offers you a 45% success rate and will give you a fresh embryo transfer typically on day 3. Our fourth package option is for 4 banked eggs to add on to your own IVF cycle. This option will allow you to still use your own eggs, but offer you the opportunity to add on additional embryos made from donor eggs, thus improving your chances for a positive outcome. There is a workup involved with our donor egg program that we do require for all our recipients. The first requirement is for your preconception labs. Preconception labs are your blood type and screen, Hep B, Hep C, HIV testing, syphilis screen, and rubella testing. The next piece to your recipient workup is the dye test, or HSG. We want to make sure that we rule out any uterine abnormalities, fibroids, or uterine polyps before moving forward with the donor egg cycle. With the donor egg cycle, we know you're investing a lot of time, money, and energy, and also emotions with this process. So we don't want to look back and regret not having looked at your uterine cavity first. With your recipient workup, we do want to look at the sperm source. If you're using partner sperm, we want to have a semen analysis that's completed within this past year. If you're using donor sperm, we just want to make sure that you select your donor sperm and have it shipped to our office prior to your donor egg cycle. The next piece to your recipient workup is the mock cycle. The purpose of the mock cycle is to see how your uterine lining responds to estrogen only. We want to make sure that we can prepare your uterine lining for transfer for when your donor is ready for her egg retrieval. The mock cycle is only required if you do plan to have a fresh embryo transfer. I'd like to take a minute to talk to you about donor selection and matching with an egg donor. We do prefer that you complete your recipient workup before you actually match with an egg donor. All our donors can be viewed right through your patient portal. To find the donors in your patient portal, you're going to go to your main frame and click on Available Donors in the upper right-hand side of your screen. When you click on that, all our donors' photos will pop up. You can then click on their photos, which will then allow you to click on a tab that says Profile. In our donor profiles, you'll see the donor's likes, dislikes, their physical characteristics, their medical history, their family history, their heritage, and if they've cycled before, at the very bottom of their profile, you can see the results to each cycle that they've actually completed. When our donors start the process, they're brought in for initial testing. All our donors are tested for cystic fibrosis along with 20 other of the most highly genetic related diseases. If a donor comes back for a carrier of any of these diseases, they're not eligible to donate. We also do various other tests like a baseline ultrasound to take a look at their ovaries and their uterus. We also look at their AMH level, which gives us an idea of their ovarian reserve. We look at hormone levels. We look at a complete blood count. and we do a physical exam to make sure they're generally healthy. When looking at donor profiles, you'll see that they're marked currently matched, available, or banked eggs only. All our donors are allowed to cycle 6 times. So if they are marked currently matched, they may become available to you at some point. You're welcome to ask any of our recipient coordinators questions about the donors and their profiles. If there isn't enough information there for you, we would be happy to look into it further. Every donor cycle takes about 6 to 8 weeks from start to finish. A fresh donor egg cycle with a fresh embryo transfer from donor's period to your pregnancy test is likely 8 weeks. We use the birth control pill and various other medications to synchronize your cycle with the donor. Your recipient coordinator will keep you up to date and give you step-by-step instructions. Our second cycle, the frozen embryo transfer cycle, from your period to transfer is approximately 3 weeks. With a banked egg cycle, from your period to transfer is 3 to 4 weeks. We don't thaw your eggs until your body is ready for transfer. We do need the sperm on egg thaw day. Pregnancy test happens about 2 weeks later. How do I select my donor? When looking at your donor, I always tell my recipients that they should narrow their list down by physical features, characteristics. And then from there, look at their profile, look at their medical history, look at their heritage. I want you to make an educated decision, so it's important to look at all the details. Is there a difference in success between a donor that's 20 and a donor that is 32? Our program allows any woman to donate between the ages of 20 and 32. We find that that is the most fertile age for any woman, and the difference in success is minimal. What do I do if I do not see a donor that I see fit? I have had recipients look at outside donor agencies or donor egg banks. If you would like more information, you're welcome to contact your donor egg coordinator. How do I know if a donor has banked eggs available? We do keep an egg bank list that is updated every Tuesday right on our website. If you go to cnyfertility.com and click in the right-hand corner on Egg Bank, you will see a complete list of our donors that have banked eggs available. It's also okay to contact your recipient coordinator for more information. Is it best to use fresh or frozen sperm? Dr. Kiltz allows either fresh or frozen sperm. We use frozen sperm all the time, and we do not see any difference in fertilization rate. If your partner's semen analysis is very abnormal, it may be best to use fresh sperm sample. You can contact your physician or recipient coordinator for more advice. What happens if my eggs do not survive the thaw? With an egg thaw cycle or banked egg cycle, we expect 50% or more of your eggs to survive the thaw. Our goal is for you to have 1 to 2 good quality embryos to transfer. If this result is not achieved and a pregnancy doesn't result from the cycle, we will review your cycle with a physician. How do I know where my transfer will take place? Currently, we're doing embryo transfers in both our Syracuse and Albany office. If you're using banked eggs or frozen embryos, we can transfer your banked eggs or embryos to either office that's most convenient to you. If you're doing a fresh embryo transfer, it's important to know where your donor is closest to. If she's closest to the Albany office, her egg retrieval will take place in the Albany office. We don't ask our donors to travel for their safety. When do I pay? For financial questions and financing options, please contact our financial coordinator. Thank you for watching our recipient video. If you have further questions, feel free to contact your recipient coordinator.